unhealthy dietary choices, leading to an increase in obesity, diabetes, cardiovascular diseases. They fear that if the phenomenon is not checked, the same people will develop strokes. Acting head of public health promotions at the Ghana Health Service, Mark Etwine, is calling for a radical change in diet and lifestyles to reverse the trend.
What is most disturbing is that at first we used to say that those diseases were more seen in older persons. Now, these diseases are being seen in young persons. So you move around and you see the obituary posters with what a shock. And a very young person has died. You ask around and they say they don't know what killed him. You go through the autopsy and you see that it's due to these cardiovascular diseases.
What do you think is the cause?
The main cause of these diseases has to do with lifestyle. At first, we used to eat our local foods. We used to exercise a lot. You come back from school, you have the chance to play football, play something like chaskele with your friends. We used to play ampe. Now, what do we have? Children wake up very early in the morning. They spend a long time in traffic to get to school. They close from school at 4 p.m. By the time they get to the house, it's around 6 p.m. They don't have chance to even play. And now when they get to the house, what do you see? They spend their times either watching TV or on tablets, in front of laptops, or on phones. So these are lifestyle issues.
Well, backing that call is Director of the Institute of Leadership and Development, Benjamin Anabela, who's pushing for a public food policy which will regulate and monitor the kinds of foods imported and how much they're sold on the market.
Now, you go into our restaurant, they prepare the food, they prepare the soup, and then there is an extra salt that is placed on the desk or on the dining table. So the person goes and sits, and based on what the person have taken within 10 minutes or 20 minutes, by the taste of the tongue, the person feels that the food is not salty, then the person add more salt into it. So when you look at it, we are taking it unknowingly or ignorantly. And that is what we're saying, that there should be a public food policy. Okay? That will make sure that there is regulation. There is a strict guidance as to what we'll do in terms of public. If you cook your food in your own home and you are going to consume it on your own, it is not public. But don't forget that if I walk into your house and then you share the food that you eat with me, it has become public. And therefore, we need to make sure that there is so much education sensitization to that. So that is what we're talking about.
Well, let's stay more on this and also appreciate the severity of the situation at hand. Acting Head of Public Health Promotions at the Ghana Health Service, Dr. Mark Etwine, has joined me, and Director of the Institute of Leadership and Development, Benjamin Anabela, has also joined me. Let me start with you, but let me say welcome, gentlemen, to News Desk. I'll start with you, Dr. Etwine. I want you to tell us about how dire our situation is as far as diabetes and cardiovascular diseases are concerned. Hello, Dr. Etwine. Hello, Doc.
Yes.
Doc, if you can reposition yourself, I think we're having challenges with the network. But whilst you do that, let me bring in Dr. Anabela, who is calling for a food safety policy. Doc, let's talk more about this and how that will change the trend we're seeing now.
Okay, thank you very much. And then good morning to all our cherished viewers. And I really appreciate this opportunity to present myself in these discussions. First of all,
Well, there seemed to be a challenge with our network. We'll try and get them back. Do we have Dr. Mark Etwine back on the line?
Yes, I'm on the line.
Right, Doc. So I wanted you to paint a picture of how dire our situation is as far as diabetes and cardiovascular diseases are concerned?
Yeah, thank you. Our situation is actually very, very dire. Because what I'm mainly concerned about is about the females. Females seem to be overtaking males in terms of cardiovascular diseases.
And what is accounting for this?
I don't know whether it's because of their diet.
Hello?
I'm even a little bit skeptical about it.
What is accounting for this, Doc?
We now have to do research into this because the female statistics are not good. We know that men take, like they take more risk than females. Traditionally, we know. But now, in terms of cardiovascular diseases, females seem to be on the high ascendancy.
Okay. So, Doc, what exactly do you want us to do about this situation? How can this situation be reversed?
I will take this opportunity to also use your channel. Diet. Let's eat our local food. Let's eat our grains. Let's exercise. Let's stop this what we call high sugar foods, high salt foods. Our local diets are good.
All right. Do we have Dr. Nabila on the line?
Yes, please. I'm on the line.
Right. Dr. Nabila, you are calling for a food safety policy. Let's talk about that and how that can help reverse the trend.
Thank you very much. And sorry for the network break. So what we are saying is that non-communicable diseases is now becoming a major concern globally because it is out taking the communicable diseases that have lived with us for a number of years now. Now, like Mike rightly said, non-communicable diseases are more of lifestyle diseases. And in fact, it can be cured, it can be taken out of our system if we are able to check our lifestyle. The 4 key risk factors to non-communicable diseases, which include stroke, hypertension, cancer, and then all the CVD, cardiovascular diseases. The 4 key risk factors are tobacco, they are alcohol, they are physical inactivity, and then unhealthy diet. So if you look at what we are calling, we've said that there are a lot of people who do not take alcohol. There are people who do not take tobacco. Yet, we cannot say that there are people who do not take food. So a healthy diet, it is one of the key risk factors that we believe from Islam that government and policymakers must make a conscious effort to regulate the food that we take. Now, if you take our diet and what we are calling on the public food procurement service and or the public food policy, we're saying that now there are standards and limits that health practitioners have outlined for us. The type of food we need to take, the type of oil that is healthier for us, and then the quantum of sodium, that is salt, and then sugar that we take. However, when you come to the low and middle income countries, we find it difficult to regulate this. And if you look at the statistic that is coming out, NCD is becoming greater in low and middle income countries, of which Ghana is one of it. So what Isla is saying is that there must be a public food policy that would regulate the food that is procured to the public. Now, if we talk of the public, we can look at it in different angles. The food that we procure by government sectors, the food that we procure for those in the hospital, the food that we procure for our students who are in school, the food that is being sold to the public by private individuals, they are all part of public food. Now, without a strict regulation and guidance, we'll be taking what is unhealthy, and then gradually the country will become unhealthy. So if you look at the PFP, the public food policy that we are calling for, there are best practices and best standards that have been outlined by the WHO and then the health expert, which we need to make sure that we apply it. For instance, we are advocating for the elimination.
Dr. Benjamin Anabila, he is Director of Institute of Leadership and Development. He's been trying to explain why we need a food safety policy. And he says we need to do that in connection with best standards or international best practice. And he says the WHO has approved of some safety practice and health experts, which he thinks we must go by. Do we have Dr. Anabila back? Hello, Dr. Anabila.
Yes, can you hear me, please?
Right, loud and clear. So you were trying to explain why that policy is very important.
Very necessary. Hello?
Yes, go ahead.
Hello, can you hear me?
Loud and clear,
I said
Dr. Anabila.
It has become very necessary, considering the health implication that it has not only on the individual, but the family, the community, and the nation as a whole. It is very important that we really look at it and make sure that we pass a policy and a law or regulation that will regulate the public.
Doctor,
that is so that. Hello?
Go ahead, Dr. Anabila.
If something is not done about it to regulate it, then I am sorry, by 2030, Ghana would be losing greatly. Like Mark said, if you look at the cases of stroke, it used to be for the aged some time past, but look at what is happening in our days. Young, able men who are in their youthful and productive years, they are the people that are suffering from these non-communicable diseases. So it is very necessary for us to put in measure, because you and I all are at risk. Today, probably we took our kose or we took our bofrot and cocoa before coming. The type of oil which is used in frying this kose and oil, do we know the type of oil? Is it healthier oil? Because what has been flooding our market are mostly unhealthy oil.
I want you to throw more light on that, because there are some wild revelations out there that the oils that we use in this part of the country, the vegetable oils, the sunflower oil, the seed oil, and what have you, are actually reused. They are used and repackaged for us. I want you to explain that to me.
Very well. So there has been some revelation as to the type of oil that is flooding our market, that in quotes is being tagged as vegetable oil and healthier oil. However, if you go into it and then you find out the background or where these oils are being imported from, you will realize that they are unhealthy. That is not to say that all the vegetables oil are unhealthy. But one of the challenges we're having is that we lack the laws that mandate in front of pack labeling for us to be able to read the ingredient that is on the what? On the label that is placed on the oil. So you look at the market, all these 4 gallon, especially to say the yellow gallon oil, they have flooded the market. And how would you be able to determine which one is healthier or which one is not healthy? That is why we are calling that there must be a law, there must be a policy that will make sure that mandatory labeling should be implemented in this country. And then also, we must be able to test the FDA, the Ghana Standard Authority, should.
All right, so Dr. Anabila has made the point there. Dr. Tuahine, what's the role of the Ghana Health Service?
I'm the Minister of Health, not Ghana Health Service.
Hello?
Hello.
Dr. Tuahine, hold on. Let Dr. Anabila land first for me. Dr. Anabila, go ahead with your point. You were wrapping up.
So as I was enumerating, so what we're saying is that.
All right, so there seem to be network challenges with Dr. Anabila, but he made the point there. Dr. Tuahine, what's the role of the Ghana Health Service in ensuring that this trend is reversed?
We have to impress upon Parliament, and this one I'm taking this opportunity to impress upon members of parliament to pass laws that will ban sugar-sweetened beverages and unhealthy oil.
In the interim, though, what does the Ghana Health Service intend to do about this situation?
It's education. Let people know what they are eating is either healthy or unhealthy. As for now, it's education.
And is the Ghana Health Service doing that?
We are doing that.
How?
And
Where?
let me use this opportunity to also tell Joy, educate people.
All right. Dr. Nabila, so this policy we're talking about, what should what should it entail?
Very much. So, for instance, if you look at the influence of sugar-sweetened beverages that our kids are taking, at least if we are able to put a policy, a law, or a regulation that bans the sales of these sugar-sweetened beverages on campuses or on the premises of the school facilities of our kids, it reduces the consumption of these sugar-sweetened beverages. For now, there is no policy or law or regulation that regulates that. Secondly, if you look at our public food procurement, there is no strict guidance as to what needs to be put in place or what needs to be the standard. So like I said in my interview when you played earlier on, why should you place an extra salt on a desk or on the dining table where people can voluntarily add as much as they can, which is a detriment to their health? So these are the things that we expect that the public food policy will consider. There are 5 areas. Now, we want to make sure that there is an encouragement in the consumption of vegetables and fruits. However, is it affordable? What can we do to make it accessible, available, and affordable, especially for our kids? Because if we are saying that we are taking sugar-sweetened beverages, then there must be a substitute. There must be a conscious effort by policymakers and government to ensure that we will be able to make this readily available. I was saying the other day that if at least in the food that the school feeding, we can have orange that can be sliced into 4, and then at least a half of the slice is given to a kid a day. It is one of the policies that can encourage the intake of fruit, just as a substitute to the taking of the sugar-sweetened beverages. If you look at the cases of obesity, you look at the cases of diabetes, you look at the cases of hypertension, all these things are contributing to it. So there must be a conscious effort to even regulate the importation. Thankfully, there has been an increase of 20% on sugar-sweetened beverages, alcohol, and tobacco, which civil society organization, we are so happy about it, that this will reduce the consumption. And these are some of the things that we are pushing, and then we believe that in the next year or 2, government will be able to come out with something of that sort, because we are trying to pursue the WHO technical package on the public food procurement service industry, in which we believe that the FDA, the Ministry of Health are collaborating with us, because we've had some 1 or 2 meetings together with the chefs, that is school health education program, and then the Ghana Health Service. So we believe that we'll be able to push this through, and then we'll be able to come out with a policy or a regulation that will really help to regulate this, so that by 2030, it is being estimated that the cases of CVD will increase, Ghana will be out of it, or the impact will be minimized in Ghana.
Dr. Nabila, I have you hold there because I've also been joined by Dr. Sebastian Sandari. He's a member of the Health Committee of Parliament. Doc, I'm grateful that you also joined us in this conversation. What do you make of the call by the Ghana Health Service and the Director of the Institute of Leadership and Development that we need a food safety policy to be able to control what people eat to stay healthy?
Yeah, thank you very much. I think I share any policy dialogue or policy regulation that would tackle the food that we eat, or let me say our food environment, for that matter. What do we find around in the environment that we live or find ourselves in? That really determines our health. And simply, we say that what you eat determines your health. And if we really look at what is happening in our various health facilities, you realize that non-communicable diseases like hypertension, diabetes, and the rest, which used not to be among the top 10 causes of diseases, now you find them probably even among the top 5, which means that the burden of non-communicable diseases is growing, and that is a serious challenge for a developing country like Ghana. So we must all join any attempt or any policy discussion that will look at the food that we eat, because we know, those of us from the rural areas, that there's some terrible change in the kind of food that we eat, because we used to eat the vegetables, the local food like cheeses and other things. Now, we are shifting, and our children are shifting away from that kind of diet to what we say, foreign diet with fats and other things, which is not good for us as a country because it's causing serious mortality and morbidity. So it's for me, and the essence of Ghana Health Service really is to ensure that, we are healthy. I mean, they provide the health services. So it's a good discussion. It's a good attempt. It's just that we have to bring everybody that matters on board in the discussion.
As a member of the Health Committee in Parliament, what do you think your role is in getting this done?
I mean, our role as members of Parliament and the Health Committee, for that matter, is to support, in the formulation of policy and regulations, backed by the appropriate laws that will ensure that what we discuss or what we want to be is backed by law, and we have to ensure that that is done. And if it comes to our level, we all ensure that we give the necessary attention and support, because it's for all of us. This is about health. It's about our lives. It's about prolonging our lives. And I don't think it will be one of those issues that will be looked at along partisan lines. I mean, we all have to come on board and know that health first, and we realize that these things, whether it's hypertension, whether it's diabetes, whether it's stroke or whatever, they don't come announcing a particular category of people. It affects everybody in the society, children, adults, whether politicians, whether teachers, or whether it affects everybody. So it's a serious matter of concern that, look, as a country and as members of Parliament, we have to look at it seriously. But like I said, it involves all stakeholders to get involved, and we get what we want to enable us to be healthy.
Mr. Zandari, I'm grateful for your time. I'm grateful to you, Dr. Anabila and Dr. Tuahine, for joining this conversation. This is a conversation that has just started. We will monitor and see how Parliament takes that up, and for us to get a food safety policy in order for us to stay healthy as a country.